Hi, my name is Talia Carroll, and today I'm going to talk to you about the major health issues that impact on the health of Australian youth. In Australia, there is a focus on prevention rather than cure. However, there are still a range of illnesses affecting the children of today. Issues such as obesity, cancer, and the ongoing support for children with mental illness need to be known and managed in the best way possible. In this short presentation, you will be shown how to identify health issues. I will guide you through some prevention measures and give you a glimpse of the roles that schools have for physical and mental development, showing the importance of exercising both physically and socially and the benefits that come from this. A mental illness is a health problem that significantly affects how a person thinks, behaves, and interacts with other people. It is a state of coping, feeling good, and being in control of your life. Mental health difficulties are becoming more familiar in kids, affecting approximately 14.3% or 1 in 7 of all Australian children. This means in a class of 30 children, there is close to 4.3 students who could be affected. Mental illnesses are of different types and degrees of severity. Some of the major types include anxiety, schizophrenia, bipolar, personality disorders, eating disorders, and depression. It is important that a child's mental health is dealt with in a positive way in the early years, preventing mental illness in the adult years. There is no single cause for depression. Rather, it's a combination of stress and a person's vulnerability to developing depression. Mental illness results from complex interactions between the mind, body, and environment. Factors which can sometimes contribute to mental illness are socioeconomic status, as this is a very common social factor connected to mental illness. Being in a low socioeconomic group is a risk factor for depression. This may be due to factors such as perceived low social status, financial problems, stressful environments, social isolation, violence, and family breakdown. Other factors such as previous experience of abuse, stress. Many students that suffer from mental illness will simply drop out of school. They are also at greater risk of involvement with the criminal justice system, resulting in jail, binge drinking, smoking marijuana, and participating in risky sexual behaviours to cope with emotional pain. The World Health Organization defines cancer as an uncontrolled growth and spread of cells. It can affect almost any part of the body. The growths often invade surrounding tissue. Childhood cancer is relatively uncommon, but it is a leading cause of death among children aged 1 to 14 years old. Cancer was the underlying cause of 18% of all deaths of children in this age group in 2004. Scientists have identified a number of elements that place people at high risk for cancer. These include tobacco. Smoking has clearly been shown to cause cancer, and a smoker is 10 times more likely than a non-smoker to get cancer. It is so important that children are not made to passive smoke, as they do not have a choice. Other factors include diet and weight, alcohol, excessive X-rays, sun exposure, air pollution, family history, and high-fat diets. There are many long and short-term effects of cancer. Some of these include loss of appetite, change of body image, osteoporosis, and sometimes death. In 2011 and 2012, more than 1 in 4 adult Australians were obese. This represents almost 4 million Australians aged 18 and over. Just over 2 million Australian men were obese, or approximately 28% of all males and females aged 18 and over. Adults have a direct influence to obesity in their children, as they scaffold the habits that children develop. In saying that, 30% of children are obese. Of these obese individuals, many of them live in remote areas. This may be because of the lack of education they receive about health, low socioeconomic status, and many more reasons. Being overweight or obese is caused mainly because of an imbalance between energy intake from the diet and energy expenditure. The children of Australia are surrounded by fatty, sugary foods, very high in energy. If they eat unhealthy foods and don't exercise, this energy is never burnt. Communities, homes, and workplaces can all influence people's health decisions. It's important to have healthy foods around for children, as they're only going to eat whatever you provide for them. Children who are obese are likely to be obese as adults. Therefore, they're more at risk for things such as heart disease, type 2 diabetes, stroke, several types of cancer, and osteoarthritis. There are many benefits that come from engaging in physical activity, especially from the younger years. With children, it is so easy to keep them active so long as you make a point of getting outside and creating games while having fun and moving your body. This activity helps to achieve and keep a healthy body weight, lower both total blood cholesterol, reduce blood pressure in people who already have high blood pressure, reduce risk of developing colon cancer and possibly other cancers, as well as reducing feelings of stress, anxiety and depression. Not only does physical activity help your child stay healthy, it also helps them socially. While playing a team sport or with other children, they feel included, enhance friendships and connection to the community, as well as increase their own self-confidence. This affects how they see themselves as individuals and will determine their motivation to get moving. Physical activity can have an impact on cognitive skills, attitudes and academic behaviour, all of which are important components of improved academic performance. These include enhanced concentration and attention, as well as improved classroom behaviour. The roles of schools include educating children, professionally trained teachers, and physical activity. The main role of school is not only to educate students about the importance of physical activity and a healthy lifestyle, but also to incorporate ways of engaging in these practices in school time. This could include incorporating movement into the classroom setting, setting homework tasks that involve moving the body, and scaffolding children's independence in looking after their own health for the future. Healthy Kids supports teachers, parents, carers, health professionals and kids by providing a one-stop shop of credible information and resources that support healthy eating and physical activity. It focuses on healthy eating habits, improving teaching of nutrition and physical education through a focus on Pdhpe programs. Crunch and sip in classrooms where children have the break to eat fruit and water is also a great incentive. Healthy Harold has been around for many years. Its purpose is to empower the young to make the best choices for safe life through our leading drug and health education programs. It aims in partnership with schools and community to help reduce tobacco use, illegal drug use, and encourage the avoidance or delayed use of alcohol. Throughout this presentation, the importance of physical education has been made very clear, not only for physical benefits, but also social. It is so important that schools implement this importance into their everyday teaching by guiding physical activity and creating a great example. If you as a teacher are a great role model, it will mean the children will join in and gain long-term benefits for life. Activated Group is Australia's leading provider of Pdhpe sporting programs, with a vision of providing sports and fitness programs to children across Australia, regardless of location, background and financial situation. These are great as they may not get to do these things outside class time. Teachers have to undergo a university course before they're given the right to teach ability to teach health. During this time, they learn about physical education. However, their learning does not stop as they graduate. This is a great program. It's important to keep up to date with all programs and new resources to improve the health of children in the classroom. It is our job to identify major health concerns that are to be taught in a professional, serious manner, as well as voicing any concerns with parents that might arise in their children.